Well, thank you, Dr. Price and Dr. Rowe. Great leaders in behalf of America's patients, because these are the people about whom we are most concerned. Every one of us eventually, unless we're very, very fortunate, will be a patient somewhere in our healthcare system. I had the great joy and privilege of practicing in a small town, Mount Kisco, New York, for 16 years. And for 9 of those years, I had my own small practice. For 7 of those years. And during that time, it was my own small business as well. I had to pay for my rent, my supplies, our furniture, our reception area, our service, our answering service, my staff, and all sorts of insurance, including, of course, malpractice insurance. Well, those costs, as all of us who live day to day and any of us who have small businesses know, those costs generally continue to rise with inflation and for various reasons. And it becomes almost impossible to keep doors open if you have payment for services, reimbursements for services, perfectly legitimate services, everything done right. When you try to do things right and an authority like the Independent Payment Advisory Board or IPAB comes in and says, you know what, even if you're doing everything right, America's spending more than we've budgeted out for health care, therefore reimbursements are going to go down. Eventually, it gets to a point at which you can't afford to practice anymore. You may need to close your doors, or you may need, and it's happened a lot around the country and it's happening ever more, you may need to close your doors to Medicare patients. That is the last thing our patients need. That is the last thing our seniors need. The American Academy of Family Physicians has said that the number of practices, the proportion of practices that cannot afford to see seniors on Medicare anymore has risen recently from 8 to 12%. And that's a big loss for America's patients. That is happening in many practices across the country. That threat will only increase with IPAB, which is why Republicans and Democrats alike are coming together to reject IPAB. And I am confident that we can bring the American public into this discussion as well to put pressure on the Senate and on President Obama to make sure that this particularly harmful aspect, this threat to care, this threat to quality that we cherish as Americans will not take place.